We're Skyping live with Dr. Gerald Hurowitz, the Chief Medical Officer for WhatsMyM3, and today we're going to talk about bipolar disorder, which has been in the news a little bit lately because of Jesse Jackson Jr.'s diagnosis. Can you tell me a little bit about, just describe and tell us what is bipolar disorder?
Let me start by saying what is a common misperception of what bipolar disorder is. Namely, there's an older term, manic depression, that is still in use, but is just one of the subtypes of bipolar disorder. And it is a somewhat more severe version of it. Manic depression is now referred to as type 1 bipolar disorder. Now, interestingly, there's a milder version of bipolar disorder that has been known about for really quite some time, but its prevalence rate has been now recognized to be quite a bit higher, and it is higher than type 1 bipolar. This is type 2 bipolar disorder, where during the high periods, the patients don't have any psychotic symptoms. They can be quite elated or irritable, even sometimes depressed and agitated, but they have tons of energy. They do not need much sleep at night. And again, lots of activity, sometimes a lot of risk-taking behavior. And, but because it's not quite so severe, it is oftentimes overlooked or mistaken for, just being an extroverted person or what have you. There are some researchers who think that there's both the bipolar disorder, which is, can be disabling and is a very, terrible thing to have to experience and should certainly be treated, but that can also be separated from a sort of a bipolar temperament where the person doesn't necessarily have the severe depressions or highs, but sort of, in general is a sort of a high energy person. Those individuals especially can be very productive and high achievers. Once someone, though, with that sort of temperament does have a depression, let's say because of circumstances, a loss of a loved one or financial stress or what have you, those individuals often have a very difficult time because doctors often don't recognize them as being bipolar. They may never have had even an episode that was that obvious or noteworthy in the past, and here they are, very productive individuals, citizens and whatnot. And the problem for those individuals is that when they get onto antidepressant treatment, in case they suffer depression, things often go awry. Antidepressants, when they're given alone to individuals who suffer from bipolar disorder, even these milder forms, can often make the person sicker.
Is it hard to, I know now we have WhatsMyM3, and obviously that screens for bipolar disorder. In the past, has it been something, because I guess, it can look like depression, it can look like different things. Historically, has it been hard to diagnose and therefore to treat properly?
It's very devilishly difficult to diagnose. It's difficult to diagnose even for trained psychiatrists. And for the reason I just mentioned, because oftentimes these patients don't have very clear earlier histories of real trouble, especially of the sort of high, in the high end of their condition, because sometimes those people, when they're not very ill, they are very productive and they're getting a lot done, they're getting awards and, et cetera, making lots of money. So even when psychiatrists who are trained to look for these symptoms ask the right questions, they often come up with a 0, and the patient goes forward and gets antidepressant treatment. When primary care doctors take the history, it's even more likely it's going to be overlooked.
And I guess as everything, earliest detection possible is ideal, because bipolar disorder, just like any other mental health, not only affects your mental health and your relationships and your productivity and so on and so forth, but also affects your physical health.
It's very important to pick this up as soon as possible. For all the reasons you mentioned and more, these patients suffer sometimes very badly from the illness, and then from being on the wrong treatment. And they may be in particular at a greater risk for suicidal behavior when they're on antidepressants alone without anything else. So that's obviously a very worrisome trend we have to watch out for. And secondly, quite a bit of evidence has been brought forth that shows that when individuals go through a fairly lengthy period of being misdiagnosed as a regular depression and not a bipolar depression, the overall course of that illness becomes harder to treat the longer they go being mistreated. So you're tending to make patients somewhat more resistant to appropriate treatment the earliest possible time that we can pick up the proper diagnosis, the more suffering, and hopefully also, of course, lives that we can save.
All right. Well, thank you for enlightening us. And of course, anybody out there listening who would like to be screened for anxiety, depression, bipolar disorder, and PTSD, WhatsMyM3.com is the place where you can get a very quick, simple 3-minute free screening tool.